there's been a lot of confusion about healthcare reform. So I thought maybe the easiest way to communicate to my clients was to have a video and explain to you some of the things that are going on, some of the things that we don't know, which is quite a bit right now. And this just gives you kind of a thumbnail sketch of what's going on currently. That way you don't have to worry right now, oh, do I have to do something now? Do I not have to do something? So this is just kind of an information 101 healthcare reform. So what I did is I wrote down a lot of questions and I'm going to try to answer them for you. So the first thing is, what is healthcare reform? I know that kind of sounds redundant, but I'm not sure sometimes everybody truly understands that. That is a federal law that was passed in March 23rd, 2010 that said basically everyone is going to have health insurance. It will be mandated, and if you do not participate, you will be fined. Well, the biggest question I think coming down the pike is, how does that affect the employer arena? And so there's several things and several ways that we may be able to look at that going down the pike. So what you need to know right now is you don't have to really do anything. We, in the state of Kentucky, have an exchange. We are also going to have a shop, which is a smaller employer arena for us to shop. We don't know who any of the carriers are going to be right now. We know no pricing. We actually don't know what any plan designs are. So there will be several options when this is developed. Now, this is supposed to be developed by October of 2013. We in Kentucky, as far as I know, will be moving forward with our public exchanges because the state has decided to do one themselves. Any of the states, which particularly our surrounding state of Indiana, has decided not to do a state exchange, so the federal government has come in and will have to set up the exchange. As we very well know, a lot of times with government, is that they're not going to be ready in time, so that's going to move to 2015, but in the state of Kentucky, we will be moving forward. Now, we are going to have what's called public exchanges, and we're going to have private exchanges. Now, what does that mean? Well, the public exchange will be a state-run facility, and we don't know who the carriers are yet, but you as an individual or as an employer will be able to possibly shop in the public exchange. Those people that need subsidies, and I'll go into the subsidy arena in a few minutes, you will have to go through the public exchange. Some of the carriers are also going to do a private exchange, and again, we have no clue what those look like. We have no pricing, no anything. So just stay tuned on what the exchanges are going to do, and as soon as I know something, I will let you know. Do you have to buy from the marketplace? No, you do not. Now, any individuals will have to go in probably the public exchange because I think that's where the only individual markets are going to be. But if you do need a subsidy, you will have to go through the exchanges, even if you have an employer plan. Now, another question that's come out is who has to buy a health insurance? Well, guess what, everybody. But if you do not buy it, you will be fined. Now, the fine for an individual that does not buy health insurance for 2014 is $95 or 1% of their income, whichever is greater. I realize that that's not a whole lot of motivation to buy health insurance, but that is the way it is for 2014. It will accelerate in 2015 and 2016. If you can't afford to buy health insurance, as again, I mentioned the subsidies. The subsidies are government and state, the word I want to use, is money from the federal government and the states that will help you buy health insurance. It's based on the poverty level. The poverty level in Kentucky is $14,500 for a single and around $22,000 for a family. Now, you will get subsidies based on where you fall. Anywhere between 100 to 400% of that poverty level, you will be reimbursed that much from the state and the federal government to help pay for your health insurance. So based on your income and on 2013, we'll be able to tell you what your subsidy will be for 2014. And there is a formula that we will have to calculate for you. Now, that sounds good, but here's an issue. First of all, right now, what we know about the subsidies and you being able to get any kind of reimbursement, you will have to fill out right now as a 13-page application. Now, let's say you tell me in 2013 that you're going to make $26,000 and we get your subsidy based on that. You file your 2014 taxes and you made $30,000. Guess what? You weren't allowed that much subsidy, so you're going to have to pay the government back. So stay tuned on how that's going to happen. But that's what has come down the pike as far as your subsidies. And again, for couples, it's a combined income of between $20,600 and $62,040, and for a family of four, that can go anywhere between $31,000 to $94,000 as far as being eligible for a subsidy. Again, if you don't buy health insurance, then you are going to be fined, and I told you what the fine would be for that first year. Can anyone get health care coverage? Yes, they can. It is actually guarantee issue now. There'll be no questions asked. You basically, I need to know what your name is, how old you are, and male or female, but it doesn't really matter because you're not going to be rated. So your next door neighbor and you together can be paying the exact same premium. So, but we cannot deny anyone going forward as of January 1 of 2014. And going back to the exchanges are going to be set up and supposed to be up and running by October of 2013 in order for us to have everyone ready for January 1 of 2014. Again, we've heard nothing from the state, so I have no clue if this is going to be ready, when it's going to be ready, but I will notify you when I know something. Other question is, what services will be covered? Basically, probably the biggest thing in healthcare reform, and the one that I approve of the most, would be that all wellness will be covered 100%. So that's a good thing. Everything else we will call what we call essential coverage. Frankly, right now, all of our policies cover essential coverage. So I don't think you'll see any change in that. The only thing you will see is the pediatric coverage. They're going to have dental pediatric and also vision pediatric that before was not in place. Also, too, there will be usually 4 tiers. And it starts out as we have silver, we have bronze, and we have gold, and then we have platinum. And each one of those plan designs will tell you what percentage of the benefit that they'll pay, whether it's 60%, 70%, 80%, or 90%. You will still continue to have copays. The new deductibles that are mandated by healthcare is the fact that you can have no more than a $2,000 deductible, regardless of whether it is a PPO or it's a health savings account. So a lot of my clients have a much higher deductible, so it looks like we may be having to go down to a lower deductible, which definitely is going to affect the cost of that. Now, some of you may have what's called a grandfathered plan. My group has a grandfathered plan. What that means is that when the healthcare reform went into effect in March 23rd of 2010, your plan design at that point in time, if you've made absolutely no changes to your plan design, you've not changed copays, you've not changed deductibles, you've not even changed what you contribute to the premiums, then you are a grandfathered plan, which means that you don't have to participate in healthcare reform until you make a change. And when I come to visit you, I will tell you whether your plan is grandfathered or non-grandfathered. Also, too, what will mean on the 50-plus market, this is one that you really have to pay attention to because there are penalties for employers that have 50 or more. You are also, if you have, say, 36 and you have 40 part-time people, then we're going to need to apply a formula to that part-time people to see if you actually equal 50, because part-time people do count toward a percentage of a full-time employee. Also, too, if you have 2 businesses, the government's now going to require you to combine those as far as a 50-plus. So we would have to combine both of those, and if you're over 50, then you have to follow the guidelines of the 50-plus. The 50-plus market says this: if your employee has to pay more than 9.5% of his income for his premium, then you're going to be fined $2,000. Also, if your employee is eligible to get a subsidy, then you're also going to be fined as well. So I don't want to go into a lot of detail at this time until we actually have more firm information, but this is just something that I wanted to put out there so that everybody could understand. I'm on top of it. I will be in touch, but I just want to keep you updated month by month. If I have no news to report, which has been kind of going on now for the last 3 or 4 months, I'm at about 20 hours of webinars a week, and guess what? At the end of it, I don't know. So I've tried to condense this to you, and I will be in touch as soon as I know something. If I get a lot of feedback that they like the video, then every month I'll try to do a video just to keep you up. You may see me for 5 minutes to say I still don't know anything, be back with you later, but I just wanted to stay in touch, and I thought this might be the easiest way for me to get in touch with everyone. Thanks.